Latest on HIV cure news, $8.5 million grant from the National Institutes of Health. Hello folks, it's Mark Medicals as usual teaching you about HIV treatment, HIV symptoms, and HIV testing. According to CDC, more than 38 million people are living with HIV today, and more than 35 million people already died of HIV-related diseases since the early 1980s. More than 1.2 Americans are living with HIV today, and the bad news is that more than 10% of Americans do not know they are HIV positive. The only way to live a healthy life with no HIV symptoms is by daily HIV medications or medicines. Though there is still no HIV cure today, there are lots of companies like American Gene Technologies, University of Maryland, Temple University, Chinese companies, etc., who are steps closer to finding HIV cure. This is also good news as far as people living with HIV are concerned. Another HIV cure research grant has been given to top researchers from world research universities. The Lifespan, Tufts, and Brown Center for AIDS Research will be supported by an $8.5 million grant from the National Institutes of Health, also called CFAR. Brown University, Lifespan, and Boston University along with Boston Medical Center have teamed up to form the Providence Boston Center for AIDS Research, and research work towards HIV treatment and cure has kick-started as we talk now. Any junior and senior investigators at Brown University, Tufts University, and their linked teaching hospitals can apply for this grant. And the news making rounds is that many researchers from those universities have already signed up to begin the research studies. More than 60 CFAR investigators from domains such as infectious disease, virology, behavioral medicine, biostatistics, and nutrition will be working together on basic science, clinical and behavioral investigations, and translational research to improve HIV/AIDS prevention, diagnosis, treatment, and HIV cure studies. One excited top researcher had this to say: "This grant renewal will give us the resources we need to promote HIV/AIDS prevention, detection, and treatment activities both here in the United States and in nations across the world. Women and underserved communities, HIV/AIDS prevention in southern New England and in developing countries, nutrition, and retrovirology are among the CFAR's key research fields, with a focus on mechanisms of viral resistance to antiviral treatment." An excited Dr. C.U. Yevon says, "We've made a long-term commitment to provide HIV awareness and information, for both clinical and research to nations that are disproportionately afflicted by the disease and lack the means to properly combat it. So, we are very excited that soon we shall kickstart studies geared to ending this HIV pandemic." Now guys, if you want to continue getting updates about this latest HIV cure news, hit that subscribe button. See you then soon with these research updates.